Hi there, welcome back to Ask the Chiropractor, your source for ultimate health, healing, chiropractic, and medical-related information. I'm your host, Dr. Adam Rodnick out of Commerce Township, Michigan.
And I'm your co-host, Dr. Ruvayn Rubinstein out of Troy, Michigan.
And we have our returning guest. We have Dr. Grace Patterson here out of Southfield.
Thank you for
Welcome
having
back,
me.
Doc.
Thank you.
Last we were speaking, we're talking about B12 deficiency and some of the micronutrient testing that you do, and how so many people are deficient in B12 that have symptoms that may be diagnosed with other diseases or diagnosing themselves from, Dr. Google. And so just by getting a blood test, micronutrient test, it can really show a lot and really relate a lot of people's symptoms and find holistic fixes for people. Is that correct?
Yes, that's correct. And people that have to understand, if you're deficient in something, it can affect the whole gamut. One of our lingos is health and wellness from the inside out. So whatever is going on the outside is a manifestation of what's going on internally. So when we do the micronutrient test, we also offer two other tests, and one is hormonal testing, and we do micronutrient tests, which goes along with chiropractic care, because you have your brain, and then the spine is housed in your spine, but you also have chemicals that are released from the brain and that system that can cause sickness, infirmity, and disease as well.
So when you do the hormone testing, is that blood work or is that urine?
No, that's saliva, believe it or not.
Oh, easy.
Saliva
Yeah,
testing. Okay, that's easy.
And it's a better test because you got to remember whatever is dumped in the blood is a byproduct. So when you do actual saliva testing, it's part of that endocrine system, so which is the hormone system. So you get better results from that. And so we test estrogen, progesterone. We do cortisol and
Testosterone?
Yes, and testosterone, all from saliva. And it's a beautiful test because you do it in the morning and 3 times throughout the day, and then at nighttime, so we can see where your levels
You do
are.
a swab?
No, it's you get actual little tubes, and you get little straws, and you actually
Spit in the straw.
Spin the straw.
yeah. So and you do that collection, and you can do those tests combined or separately. And the neurotransmitter test is the second urine of the day.
I like how you're allowing our guests to understand that your nervous system controls everything, because a lot of
Right.
patients come into my office and they have hormonal imbalances and they've tried everything and they don't understand. And I let them know that your brain and your spinal cord control all of your regulators in your body, all your adrenal glands, every hormone in your body's regulated from your brain. So if the
Right.
signals aren't there, things are going to go wrong.
Right.
If we can rewire the signals to be functioning at 100%, all those hormonal regulators are going to start functioning, your dopamine levels, people's lives change. I was published in a chiropractic journal on Parkinson's disease. And most people think Parkinson's disease is a debilitating disease that's irreversible. Well, I had 3 patients under specific chiropractic care that got better and better because we started regulating those hormones.
And a lot of times patients don't really understand why something may have changed. And so that's why patient education is so important. It's important for us to really educate and talk to our patients, to do things like we're talking about today on our television show. We'll have patients come in and let's say they didn't do anything different. They didn't even, let's say, change their nutrition. They didn't change exercise. They didn't change their medication. And all they did is see us. And all of a sudden, they went to their next appointment and their creatinine levels were different and their blood urine nitrogen levels were different. All the kidney function tests were different. But we worked on the nerves at T12 and T10 that control the kidney function. And a lot of times we can see really good results. Not that we cure these different conditions, but if we can keep the body functioning at optimal, a lot of times the body can regulate some of its own hormones, neurotransmitters, and be more regular. Now, so tell us a little bit more about the neurotransmitter testing. So that is not saliva and it's not blood work, that is urine test,
That's
correct?
a urine test because that's a byproduct. After you break down those chemicals, it's dumped into the urine. And so if it's not being regulated properly, you can see the different levels. And all 3 of those work together synergistically. So just like, for example, I'm going to use the patient, the vitamin B12 deficiency, had high norepinephrine, epinephrine stress levels because you need the vitamin B12 to work with the enzyme to break it down. Yep. So when we did her neurotransmitter testing, those were totally off the chart. So she had panic and anxiety along with her situation. So once we started supplementing with the vitamin B12, At the time, I didn't know you, Adam. I could have, or you. I could have sent her to you guys too, so we could have gotten a whole rounded picture for her for maintenance as well. Matter of fact, I think I am going to send her to you guys.
We'll take
One
good
of you,
care of her. I promise you
absolutely,
that.
because after we do that, we want to maintenance is the key. You know, this is what I tell people: you take your car in every 3 months, every 3,000 miles. But for oil change, and then some of us just neglect our bodies. You can get another car, but you can't get another you.
Yep.
You got it, exactly.
So, and I think what you guys provide is maintenance.
Absolutely.
Absolutely. And we see the same thing with,
Yeah.
again, I use an example like dentists. People go to a dentist if they have a toothache, but they also go to a dentist to get their teeth cleaned. They also brush and floss their teeth every day. That's the only part of the skeleton they take care of. They don't think about their spine until they have a toothache off their back. And we'll take an x-ray on someone, and we'll see that it's literally rotting away and decaying. There's osteophytic formation, there's spondylolisthesis that's been undiagnosed for years, and it's just rotting away. There's not much left to some of the discs, so much degenerative disc disease, deterioration, and they literally never thought about it. Now, can we help that person? Sure, absolutely. We can help them feel better. We can help them function to some degree better. However, if we would have saw that 30 years ago, could we have prevented a whole lot of problems for them? Absolutely. So the earlier we take care of ourselves, the earlier we catch things, the better. And that's why even in our office, we take care of people of all ages. We check children, teenagers, athletes, babies. Anybody who has a spine can get it evaluated.
That's wonderful. Well, I'm going to have to take that in consideration for my seniors too. Think about it. I mean, a lot of them that we go and see do have most of them do have some back pain.
Yep.
Be it spinal stenosis, like you were saying, and things of that nature. Just think about it. If they would have known a little earlier, you know, the degenerative joint disease that you're talking about.
And you see the little lady with the hunch like this, that didn't just start last year. That started 45 years ago, you know, little bit by little bit. And we'll take x-rays, let's say someone now in their early 20s, we'll see that the curvature in their neck is missing, or that it's shifted a little farther forward. So think of this, let's say I held a 50-pound weight in my hand here. It's a lot easier to hold it here than it is out here. So just a little bit forward, 1 inch forward, we're putting an extra 10 to 15 pounds of pressure constantly at the bottom of the neck and the upper back. Well, over time, that's going to keep increasing that curve, building up those muscles, and eventually you start to roll the shoulder, and you see this, you know, hunch type of posture that you think of as little old ladies, but it starts in younger people that are constantly on their phones, text messaging, and on the computers, and just literally hunched forward all the time, weight bearing 2 to 4 times the weight of their head, right through that upper back area.
And it's cool when you evaluate someone. We sit down with all our patients, we speak to them, do a full case history, and I can basically tell them what I'm going to see on their x-rays. And I have them write it down in our consultation. I go, write this down, and when we take the x-ray, I have a feeling that those areas are going to be either pinched off, degenerated, and about 95% of the time I'm spot on just based on their symptoms of what's going to happen. And the issue is a lot of people think that it's due to normal wear and tear of their body. Oh, I have this degenerative disc disease. I have arthritis in my spine. My doctor told me it was due to normal aging of the spine. I got my left hip replaced. My doctor said it was normal aging. I asked them, ask the doctor, was one of your hips older than the other one? No. Was one of your segments of the spine older than the other? No, your spine's one age. Something happened to that area to cause it to degenerate faster. So our goal is to find those areas and make sure that they're not degenerating faster, to make sure everything is functioning properly. Your body's one unit. If we can get that one unit to function at a whole, things work better.
Absolutely.
Let's talk a little more about the neurotransmitter testing, and can you explain to our audience kind of what neurotransmitters are, what they do, what some of them are, and how they relate to the body?
Right. Neurotransmitters are chemicals that are released by the nervous system, by the brain. The ones that we test for in our panel is the serotonin, and most people are familiar with that one because that's related to depression. And it's generated and made in the body by sunlight. So you also hear about summer months, you know, the UV lighting. More people tend to have the blues than any other time because of lack of sun. So we test for that. We test for the norepinephrine and epinephrine. We call those in the medical field fight hormones. And being that we live in such a high stress environment, we're not supposed to be in a flight or fight stage all the time. And those hormones being, those neurotransmitters being as high as they are all the time can cause sickness, infirmity, and disease in the body, because you're not supposed to be ready to run or ready to fight
You're
all the
supposed to be
time.
able to rest and digest.
Absolutely. So we also do the GABA. We also do, I think it's serotonin and dopamine. When you talked about dopamine is very key in the Parkinson's disease and the neuromuscular diseases, and also addictive behaviors.
Yep.
So we're probably going to talk about that a little bit later, but dopamine is also the addictive behavior in food and eating. So a lot of people that yo-yo diet, a lot of them don't understand that it's a neurotransmitter thing that is not going on right with them. So we test all of that and try to get that going. And like I said, with you guys being chiropractors and you doing the adjustments, and people are seeing changes only by manipulation. Just think about if we can find out and supplement them with natural supplements in conjunction with that, we're going to have a whole lot of superheroes running
Absolutely.
around.
And there's different parts of the spine that when you do adjust, it's a sympathetic or a parasympathetic response just based on the area of where it's going. So I can definitely see how we can work together to make sure our patients are getting the best possible care.
Absolutely.
And so I know you also just started doing neuropsychological evaluations as well.
Yes, we actually have, they're more so screenings, and we test for the neuropsych, which will allow us to see if they have any bipolar disease or early stage of dementia or Alzheimer's disease. That's like a screening test, like 40 questions we can do in the home, or we go wherever the patient is with that because we have it on our tablet. And we also do what we got psychological testing for depression and anxiety, based upon what we're talking about, the neurotransmitters being off or their spine being off. They're releasing these chemicals that cause certain type of behaviors. And I also, not only in our seniors, but our children as well, because some parents get phone calls, my child is not behaving well in school. So is it really a behavioral problem, so to speak, or is it a biochemical neurotransmitter problem?
Yep.
So we can do the screening test and also do the neurotransmitter testing and see where they are, and also call you guys and say, hey, we have a child that, the parents are concerned, so is the teachers, instead of putting them on the famous Ritalin and the other Adderalls and all those things that are narcotics, controlled substances to our children.
That's amazing.
Absolutely.
I love the sound of this.
Yeah,
Let's do it.
All right.
Let's do it.
And so what exactly, so the neuropsychological screening, what does it entail? Is that physical testing, or is it more of questioning?
It's real easy. It's more about questioning. This past, I think it was September or August, it was Mental Health Awareness Month, and we kicked it off then, and we just asked a series of questions, and after that questions, it'll spit out the results. This person is exemplifying major depressive syndrome or major depressive disorder, and right then, they're grateful that somebody, especially my seniors, they're glad someone asked them those questions, because they're dealing with chronic illnesses. A lot of them are in the homes by themselves a lot, don't have one checking on them, visiting them, and for us to just ask those questions and to be able to assess it right then. And a lot of them are not on antidepressants. So that's a time right then I will prescribe. And the next time I see them, their mood is up, they're better, they're more interacting with you, they're keeping eye contact with you. It's just been really amazing.
But you're not only prescribing.
No, I'm not.
You're doing a series of things to help them change.
Absolutely.
Because like you said earlier, you don't want to keep them on these drugs for life.
No.
Your goal is to get them well with a series of whatever it may be.
But in an emergency situation, the medication can certainly help and can be a key component into bridging them into to doing the right things.
To wellness. You're absolutely right.
And so then you correlate the information from the neuropsych screening with the neurotransmitter evaluation?
Absolutely. We connect those things together, and then once we do that, like I said, we do supplementing also, I say it's treatment. I call it blueprint treatment. So whatever those values are is tailor-made for that patient. So instead of like the Prozac is for everybody.
Yep.
Regardless to what your neurotransmitter level is, regardless to what your hormone levels are, here's this Prozac
It could be
to make
20
that,
or 80. It doesn't matter.
absolutely, to boost that serotonin level up wherever it is, because we really don't know. Here, take this.
That's based on just symptoms in general, usually.
Absolutely.
It's nothing to do with blood work or neurotransmitters or anything.
Absolutely, but the beauty of what we're doing and what we're talking about today is customized for that individual. So whatever.
More objective.
Absolutely.
Instead of just, how do you feel? You feel bad? Here's this. Next.
Absolutely. And so what I tell, the joke is when I talk to patients, so there's no sharing medications or sharing supplements with your friends and family, because what we're giving for you is tailor-made for you.
This thing feels good. You want to try one? Yeah.
It's specific care.
Right.
And I mean, that's how my office runs as well. I tell every patient, your symptoms can be the same as this person, but you're not the same person.
Right.
The approach is different, and everybody gets their own care plan.
Right.
I can give them a range of what I think it may take, but everyone's body is going to react differently as well. So you have to make sure you have that one-on-one approach with each and every patient. There is no blueprint for a person.
Absolutely.
There's way too many things going on. There's 70 trillion things going on in the body at any given second. Nobody's the same. So you have to make sure. So it's awesome to know that there are people like you that we can refer our patients to that are going to get that quality care.
Thank you.
We have a little video we'd like to share just about neuropsychological evaluation, and we'll go ahead and we'll roll that clip and we'll come right back.
The knowledge behind brain trauma in children and adolescents is increasingly advancing, and the way in which we screen and treat is gaining more attention with modern-day medical advancements. Children in residential treatment centers are among the highest at risk for past traumatic brain injuries. Routinely, they have lived in many different settings and are at the highest risk for brain trauma due to patterns of reckless and careless behavior. Clinic Care has added neuropsychological testing to the assessment and evaluation process at all of its residential treatment programs. Neuropsychological testing is an integral component of the assessment and treatment of not only brain injury, but also neurological conditions, psychological and psychiatric disorders.
Brain-based assessments and intervention modalities create the secure possibility of improved decision-making, problem-solving, emotional and behavioral regulation for the youth for the rest of their lives. The process of assessment and retraining eliminates non-productive thinking patterns which were possibly created by trauma, AODA, ineffective processing, mood struggles, or anxiety, which, in effect, allows for new opportunities for youth. To best meet a child's behavioral and emotional needs, it's necessary to evaluate how he or she takes in information, processes it, engages it, and is able to understand it. My frequent response, brain function is the seat of all learning, emotions, behaviors, and information processing. The best way to keep young people out of trouble and in control of their lives is to teach them in ways that meet their learning styles, developmental needs, and facilitate effective decision-making. Support for this type of intervention is best addressed through the brain. Almost 95% of adjudicated youth have unrecognized brain injuries, learning disabilities, and mental health diagnoses. Many of these youth began demonstrating significant behavioral difficulties by the second and third grade. As the learning becomes less successful, their behaviors escalate and eventually involve them in the judicial system. By the age of 13 years, these same youth are unable to read second-grade sight words, add, or spell. These children easily engage in avoidant, class clown, and destructive behaviors that facilitate further alienation in the learning process and increase the likelihood of engagement in delinquent behaviors. What I find with this population are many missed opportunities. In third grade, children begin to do work away from the group, learn and produce more independent work. This is when children realize that they are not learning at the same pace as their peers. This is where the class clowns develop their acts, and avoidance behaviors become a way to deal with not knowing how to learn. Brain research tells us that the development of the frontal lobe, responsible for planning, organizing, problem solving, and decision making, is not complete until the age of 26 years. Youth make impulsive decisions, often the result of current emotions and environment stimulation in the moment. But If we, residential treatment centers, know how the brain functions and processes information, we can provide education, therapy, and support in very efficient and effective modalities to create better understanding and incorporation of the information. Combining the results of the neuropsychological assessment with the many new brain-based interventions, treatment can be individualized to develop specific interventions to support better processing of information and decision-making. These then become lifelong skill sets to support lifelong learning.
And as we can see, there's just a lot more insight into the way that the brain functions now compared to 30, 40 years ago. And you see more information on big media now about concussion testing, and everything that's been going on with the NFL and the NHL and post-concussion symptoms. And so it's really important to not only take care of our head and our brain, but also to make sure we get evaluated. If there's any evidence of trauma or anything like that, it's important to get evaluations. We just had yesterday a patient that fights MMA, and once you've had 1 or 2 concussions, it's easier to get another one, and then the more you get, the more trauma and the more permanent damage can start to happen to the brain. And I take care of a lot of football players, hockey players, fighters that we see repetitive concussions. And so our care certainly helps with the post-concussion symptoms, but it's important just to know when they've had concussions, to know how long to stay out of athletics or out of susceptible trauma, and then also to know what to avoid in the future as well. And so you do neuropsychological assessment for trauma, is that correct? So concussions, injuries, car accidents, traumatic brain injury as well?
Absolutely. Or just like I said, when I go into my seniors' homes, I do that for them as well, because the dementia.
Dementia, Parkinson's, Alzheimer's.
Absolutely. And so I do have quite a few MS patients on my roster. I haven't gotten around to them yet. And I'm trying to figure out a way where I can get them to start doing the neurotransmitter testing to an insurance to cover for it, because I would love to see where their levels are. And even I have a couple of people that have fibromyalgia, and I have this one patient, we try to get her to do the neurotransmitter testing when she has a flare, but she's so out of it, we can't get her to do it. But I would love to see where their levels are as well, so we can see a pattern, and if we can pick up that pattern and we can treat it naturally, hey, that'll be awesome.
Yeah, we
do you work with neurologists with some of those different conditions as well?
Believe it or not, right now I haven't developed a link or any colleagues that I could work that with, because when I started doing urgent care, that kind of like pushed me out a little bit with out of the mainstream of things. So I'm just now getting back, and then home visits too. Home visits too. Like when you're in a home, it's not like you're at a location or have a group of people that you're with all the time. It kind of isolates you, colleague to colleague, social colleague kind of thing. So I'm trying to get back in the mainstream with you guys.
And it's not so easy to find someone that's also willing to go to somebody's house and do it.
Man.
To find, we need to build you a team.
Yes, please. That would be awesome.
Yeah, we'll build you a team and get everyone taken care of. Do you do a lot of work with MS patients?
Well, it just happened because of the home visits, because it's hard for them to get out. So that's how I have been inheriting and encountering these patients, is because of that.
Because we do a lot of work with MS patients, and it seems to help a lot to just get the pressure off those nerves. I mean, if that MS is when the sheath around the nerves is missing, so everything that's going on is excited, more hyper. So just by rearranging those bones, getting the pressure off the nerves, it helps a lot. It really does. So it's cool to know that you deal with MS patients, because I deal with a lot, so I'd like to just want to work with you.
Well, good. So I understand you guys have transportation, so we can set up some transportation. I'm seeing a patient in my head right now. So I can get them over to see you, All
right, awesome. And then what we see a lot of times too is, like you said, with the traumatic brain injury or concussions, a lot of times even we can see that happen without even the head impacting. A lot of people think, let's say they had an accident or a sports injury and their head didn't actually
hit something,
directly come into contact with the steering wheel. But think of it like shaken baby syndrome. Baby is shaken up, the brain kind of gets scrambled in there, and that's what we call coup, contra coup trauma where the head goes forward so fast inside the skull, the brain can kind of rattle around here. Essentially, shaken baby syndrome for adults. Let's say it's a car accident, hit really hard, seatbelt stops. Even if the airbag didn't go off, the head goes forward and inside can rattle around. So we see a lot of people that come to see us with undiagnosed brain injuries, or even a last resort. They had already seen so doctor, and or they went to the hospital who said to follow up with their primary care, and then they were out of medication, but that's it, and no one really diagnosed them or looked into the scenario of brain injury.
No one was dealing with the underlying causes. And a lot of people don't think that, the holes in the boat, exactly. A lot of people don't think that auto accidents, another thing that I was saying, that when we sit down with a patient, we have to let them know, have you ever been in a car accident? No. Have you ever been hit by another car? No. Have you ever ran into a wall? Yes. People don't associate what a car accident actually is. And then I've had patients recently, they said, oh, I was in a minor car accident. Well, what does this word minor mean to you? Well, I hit a car going 45 miles per hour and I spun out and ran into a wall on the freeway. I go, what about
You're
that?
alive,
I was like,
so
wow. I said, wow, I can't imagine what a major car accident to you would be. But these people, their perception is their perception. It's whatever they think it is. So that's why it's good to get a complete evaluation on these people to make sure we know exactly what's going on. Have people to send them to be able to do these neurological evaluations and work together to get our patients well. And that's my goal. That's why I became a chiropractor, is to get patients well, to get the community well, to get the world well. Let's change the world together.
Absolutely. When I was thinking about what Dr. Adam Rodnick was saying about being the brain being shaken in the skull, just think about a senior. Their brain shrinks as they get a little bit older. Even if they just had a minor fall, I'm quite sure there's some rattling going on
the
as
body stops and the head keeps moving, especially if there's already insufficiency and instability in the cervical spine. It creates more trauma in the head too, because if the cervical spine is not strong enough to support such an impact, it goes forward like this. Even just a minor, you're watching here, a good healthy normal curvature should arc backwards like this in the spine. Watch where I'm going to go here, less than 5 miles an hour. Immediately the curve just changed.
Right.
The head got thrown forward,
Right.
and again, it can cause trauma inside to the brain. So even, trips and falls, but sports injuries, all sorts of different things that.
So guys, I just learned something new here. So that's what I'm saying to you, because like we're trained in the process of asking questions. If someone falls, did you hit your head?
Yeah.
Any loss of consciousness. But I never took in consideration, maybe they didn't hit the head, it was just a rattling around.
They had loss of consciousness they didn't tell you about, right?
Absolutely. Right. So that has to be taken in consideration.
Dizziness, headaches, some of these things can.
Absolutely.
And the problem is most people, their head is not where it's supposed to be. Video games these days, cell phones, text message, most of the patients that come in, they don't have that curve in their neck and it's straight. So we're going from a straight neck, and now it goes to reverse. And the reverse curve is what I'm seeing more and more in my office. Oh, wow. Forget a regular curve, forget a straight neck.
Even in young people, we see it.
Yeah, younger and younger generations. Everyone, they're on their cell phones all day. They're on their computers all day. Their curvature is so bad, their posture is so bad. And now on top of that, you get into that minor accident, that minor slip and fall. You don't bump your head, but the curves were so bad that it's actually a worse whiplash injury than if you had the normal curvature.
Wow.
So
that's all the time we have for today, and this has been Ask the Chiropractor. I'm your host, Dr. Adam Rodnick, out of Commerce Township.
And I'm your co-host, Dr. Ruvayn Rubinstein out of Troy, Michigan.
And we're here again with our special guest, Dr. Grace Patterson out of Southfield.
Thank you.
It was a pleasure.
Thank you.
Absolutely. Thanks for joining us.
Have it.
And we will see you next time on Ask the Chiropractor. Stay healthy.